All right, everyone, welcome to Health Matters, episode 16, week 13 recap. Well, it was quite a week for health again in the NFL. We're going to take it away here, Brandon, and tell us kind of a theme of ankle fracture and injuries this week. So
Yeah,
take it away, buddy. Here we go.
yeah, definitely some stuff. Tyler, let's lead it off with the biggest one of the day. Who we got?
Yeah, guys, as we recap week 13, get into week 14, like Doc said, health matters. Health matters more as we look at these teams trying to get to the playoffs. And Kenny Pickett is going to be one of our biggest injuries from this past weekend. Got rolled up on that ankle, and now they're saying out 2 to 4 weeks for ankle surgery. Doc, this looks like something that you've seen a million times. What are you thinking on this? And how should he come back from this?
Yeah. Yeah, well, at least from the video analysis, the way he got rolled up on, we're concerned about at least a significant syndesmosis injury, which is the ligaments between the tibia and the fibula for allows widening of the ankle. You'll recall Tua Tagovailoa, when he was at Alabama quarterback, had this surgery, which is the tightrope surgery. Now, I'm just guessing. I don't have his x-rays, but based on what they're saying, a 2 to 4 week return, he could have a small fibula fracture, Pickett that is, plus this syndesmosis injury, which is very common just based on his mechanism. So you get a fracture of the small bone on the outside of your ankle, and you get a disruption of the ligaments here. So generally a small plate plus this tightrope or just the tightrope device. You'll recall that Tua came back in about 10 or 12 days after his surgery. He didn't play that great in the championship game, but he was still able to get back and play. And I think that's what they're trying to do the same with Pickett because they're in the bubble for a wild card. And it's going to be important to get their quarterback back there, especially with all the injuries that Pittsburgh's had.
Yeah, definitely so. He's definitely a guy they need to make that run for that wild card spot. They got an easy matchup this week against the Patriots, so hopefully that'll give them a little momentum moving forward. The Saints quarterback, Derek Carr, is back on the injury report again. He took a massive hit from Bruce Irvin, drove him down to the ground. He is in the concussion protocol for the second time in a couple weeks, and he also was holding on to that right shoulder again, that AC joint he sprained a couple times. They're even calling it a back injury on there as well. So just a multitude of injuries on that one play.
Well, he epitomizes almost what we talk about, just being banged up. He got banged up in multiple areas, back, AC, and as well as head with the concussion protocol. These go together, and especially AC and head, just the way the close proximity. The AC joint again. Here's your shoulder joint that can move around. The collarbone comes in here into the acromion, and there's a very thick capsule, as you see right here. This thick capsule is really important, but when you sprain this capsule or keep re-injuring the AC joint, you end up popping this bone out around the capsule, injuring the capsule, tearing it. Richardson, quarterback for the Colts, had this bad enough that it was unstable enough for the throwing arm. He actually elected for surgery right away and shut down his season because it's a pretty long rehabilitation to repair and or reconstruct these ligaments. And sometimes you need cadaver tendon and special tightrope devices, sutures, tension devices. So we'll see how this plays out. He keeps re-aggravating it, which to me means he hasn't healed it. Carr has not fully healed this AC joint. It's the capsule here is weak, and there is probably a chance that he may need something in the offseason if he is able to get back to his true form. So expect a few weeks out for him is what I would say. I would say about 2 weeks out. Could be out on average. Again, our data at the Predictors would say about 1.8 weeks, especially with injections in the joint. But Carr has also had this several times, as Brandon alluded.
Yeah, we're really hoping that he can finally get rid of this nagging injury and get back on the field and be his true self out there. So then we had Texans wide receiver rookie Tank Dell. He ended up fracturing his fibula. He got caught up in a pile right in front of the end zone. He went down hard and down awkwardly. He was not in a good mood after. You could see he immediately knew he was not feeling good. Something was seriously wrong with his leg. Doc, what are you thinking on this?
Yeah, Ryan, 100%. He knew right away, and you got the fibula bone out here. It's very susceptible to significant ankle twist, getting rolled up on. Sometimes a direct blow, but usually it's a twisting plant mechanism that causes this bone to fracture, usually with an oblique or angled fracture, fixed with a plate, screws. Usually it's about 4 to 6 weeks minimum to get back, maybe a little bit longer. And generally, we usually just say 3 months to get back, get the bone healed, get the muscles strong, because the muscles around here, which are called your perineal muscles and attached to the bones out here, super important. And it takes a long time to rehab those, wake those up after the surgery, anytime you put a plate on the fibula. So that's the timing here. It's a minimum 4 to 6 weeks, but I think it's actually longer for Tank to get back.
Yeah, and last night's game, Green Bay was able to get the win over Kansas City. However, they may have lost Christian Watson for some time. He tried to stay in bounds to keep the clock running and looked to have re-injured that hamstring that he had previously injured in the year. Doc, we know hamstrings are already tough in that wide receiver position, but a re-injury to that is even tougher. This could be big for them as he's a huge target for Jordan Love.
Yeah, congratulations to the Packers fans last night. But even Watson went out of bounds. It was before he held up a couple steps before you could see that he tweaked that hamstring, re-aggravated it. We know the re-aggravation index on this is quite high with hamstrings. They did wait a while to bring him back from this season from prior injury, but he could be out, I would say, at least 2 to 3 weeks, if not longer. And when he comes back, we're going to see a decrease in 15 to 20% in his overall offensive productivity.
Yeah, and keeping in with that same game last night, Sunday Night Football, the Chiefs safety Brian Cook, he ended up getting carted off the field with an ankle injury. He had x-rays that came back negative. They just announced this morning. So good news for him, but that looked pretty similar mechanism to what Tank Dell injured his ankle, except no fracture on that one, and you had a much better angle to see it. Doc, what were you thinking on there?
Yeah, we were really concerned because, the team was out for him, card, et cetera. And again, concerned about a fracture. Fortunately, the x-rays were negative. So now we're just talking about significant soft tissue in the outer lateral side, potentially the syndesmosis, and also these medial ligaments. When these medial ligaments get involved, it's a much more severe injury, and he may have that. Maybe not 100% out of the woods for surgery even at this point. He just doesn't have a fracture. But even with soft tissue, sometimes you need to get this stabilized. The reality is it's tried to rehabilitate it first, and hopefully 3 to 6 weeks, depending on the severity and what an MRI shows. Again, in keeping with the theme this week, a lot of kind of tough ankle injuries for the teams to deal with.
Yeah, another one, the Patriots running back, one of their star players and bright spots this year, Rhamondre Stevenson. He had a right ankle injury on a hip drop tackle. The hip drop tackles have been pretty new thing this week, a new topic lately with all the injuries occurring from them. What are you thinking on the hip drop tackle, Doc?
Yeah, a new type of tackle. The NFL is trying to get its hands around it. So anytime a new rule, new enforcement comes in, new different flags, we see different injuries. It goes back to the basics when the concussion situation really was starting to targeting flag and everything else came out. What do we see? We did see a little bit of increase in lower extremity targets, hits, injuries to the abdomen, pelvis, some other areas initially. That's kind of settled out, but it's going to settle out, Brandon, I think, over time. It's just how the players adapt to the new rule and some of the flags and hits that are associated with those.
Yeah, you hate to see a guy getting hit on the same tackle over and over again and injuries occurring. Ryan, take it away with the concussion protocol this week. Who do we have in there to watch?
Yeah, a few guys that went into the concussion protocol this week was Falcons cornerback A.J. Terrell, Browns wide receiver Amari Cooper, Chiefs linebacker Drew Tranquill, Rams tight end Tyler Higbee, and Titans running back Derrick Henry.
All right, everyone. You check us out at thepredictors.com. Lots of stuff going on. Health really matters. We're getting into just finishing week 13. We're coming to week 14. And these weeks are super critical, especially as we get into playoff seeding. And our data at the Predictors is really helpful to figure out what teams are going to make it in the playoffs and which of your teams are not.
And on that note, we also have a little fantasy news as well. Tyler, how's your fantasy team doing? Who are you looking out this week to play and start?
Yeah, well, this week is a lot less bye weeks, so the Bills stars are back. So on my team, I'll be playing them. But one of the biggest things for this past week was Chris Olave making it out of the concussion protocol. That was something that everybody was watching. We know from our data at the Predictors that, these players have to safely recover from concussions, but when they come back, they tend to actually do better. And sure enough, Chris Olave was on that field and had a big day, 16.9 points if you play in a PPR league, had 8 receptions, 119 yards. So that's a big day for him. and something that a lot of people expect out of him, the way he was last year and this year. And a great day for the Saints watching him, and that he was able to safely recover and get back on that field.
Yeah. Another guy trending up is going to be Breece Hall, the running back for the Jets. He's coming off a hamstring injury, but he ended up with 10 points. He had 13 rushes, 16 yards, and then 6 catches for 29 yards. So a lot of utilization there. So hopefully his yardage will be moving upward next week.
Yeah, again, here's the hamstring issue. It's just not the same for multiple weeks in that same season. When you're coming back, 13 runs for 16 yards, not that great. That's not Breece Hall. He did get 10 points, so fortunately, fantasy owners, you didn't get completely hosed on if you played Breece, but it should get better. It's going to get slowly better over the next 2 to 3 weeks for him, but I don't see exponential improvement or the usual Breece Hall for at least another 2 to 3 weeks.
And with Breece Hall coming off of the ACL that he had last season, do you think that could have played a factor into him developing the hamstring injury and dealing with this issue this season?
Ryan, no question. Thanks for picking up on it. But again, our data at the Predictors shows that we know that after ACL, hamstrings go. We know after hamstrings, guess what else gets injured? The ACL, they go together. So these are things we really have to continue to work on. It's something we worked on when I was head team physician of the Patriots and really trying to get on an injury prevention protocol. Nothing's perfect, but we really try to focus on that. And the players are working really hard on that. Just sometimes things happen, Ryan, but we do know that those are associated.
Let's hope that he can get back on that field, get healthy. He's an important piece of that Jets offense. Then moving on, we had Keenan Allen. He tweaked his quad last week during practice. He ended up playing against the Patriots. He put up 10.8 points on 5 receptions and 58 yards. And according to our data from the predictors.com, our wide receivers, when they miss 0 games after a quad injury, they tend to be down a significant amount, around 5 to 7 fantasy points on that. Doc, I don't know if you have any thoughts on here.
Yeah, the quad's tough. It's the biggest muscle in the body. The quadriceps is as 4 muscles belly. Quad is 4. They all have to work together. They got to get rehabbed after contusion, after injury, after strain. It just takes a while for this huge muscle to get better. And so that's what our data shows. They're down for multiple weeks when they're returned. And everyone, let's not forget, we got Aaron Rodgers. What is this, 21? Is he in the 21-day window now?
Yeah, it opened up last week.
I mean, what's going on with this? So, I mean, we've been talking about him forever. Obviously had this, tightrope procedure, repairing the muscle tendon area all the way down to the bone using a double bridge technique, nice tape suture, a bunch of anchors. The beautiful thing of that is with an anatomic repair and really good, strong fixation, you feel really good out of the box. But guess what? You still got to rehab. You still got to get the muscle back. And if we had a way to get that muscle back sooner, quicker, faster, it's just like these ankle surgeries that are all going to happen this week from all the players that got injured. You can get the bone to heal, you get the ligaments to heal pretty quickly, but it's another 6, 8, 10, 12 weeks to get those muscles conditioned. And that's the same thing with him, especially the calf. It's the largest muscle complex in the below the knee, obviously, and it's a really important area to rehab. And I think that's where, if you actually put a tape measure on Rodgers' calf right now, Brandon, what do you think it would show?
Oh, it's definitely probably 30% less on the other side, at least.
Yeah, if you have 24, 26 centimeters circumference, maybe his are a little bigger. I don't know. I haven't measured them, but going to be 20 centimeters, 22 centimeters instead of 26 centimeters. That's the reality. When we put a tape measure there, where he's at now, 10, 11 weeks, it's going to be, I just don't see him coming back.
His arm may still work, but I don't know about that explosive running away from those big D linemen.
That's right. It's he's got to get that muscle back, and to get that centimeters of muscle, we're not just talking a few millimeters here. We're talking centimeters, right? You put a tape measure on these players all the time to show them where the deficits are, right?
Yeah, and it's noticeable atrophy for sure.
Would it even be worth him trying to truly get back on the field, or is it more him getting back on the practice field, helping the morale for the team, just help the team out in any way he can?
I like the Jets hype. I like that they're doing it. I don't know, Tyler, what do you think? Is this hype? Is this getting it out there? Is it a discussion point? Is it,
I think
we getting better at rehab?
Yeah, I think it's a little bit of hype, to be honest. I think he wants to come back. I think in the beginning, he probably meant that he was going to come back, but you have to keep in mind, where are the Jets with their playoff hopes and his career? And if they don't have a chance to make the playoffs, then he's not going to come back and risk his career, risk next year, or maybe even a year after, however long he's trying to play. I don't think for a few regular season games. It just doesn't make sense to him. It doesn't make sense to the organization as well. So if I were him, I'm taking the rest of this season off, especially how the Jets have played, and then I'll come back next year and hopefully lead them to some better success. Yeah, for him, I would come back and play. Honestly, I think he could have came back uh, 2 weeks ago, but they had that bye week last. They had that bye week this week. Sorry. So I think they just wanted to give him that extra amount of rest, make sure he was 100%. I mean, he came out, he tweeted, if you saw that he didn't care about anyone's fantasy teams and that his health was all that matters, which of course it is. And that's the truth. But I think they wanted to give him that extra week with the bye week. And so this week he'll be back. I think he's been probably chomping at the bit to come back and play with his team. They had a little bit of success when they first got Dobbs there. After that, they did take a couple losses there, but with him back in the mix, definitely gives them a better chance to win. So I do think he should come back, and I think he will. Yeah, that's it. That's a great question because we always come in here and we talk about hamstrings and how bad they are when they first come back. But it's Justin Jefferson. I'll take a couple percent lower on Justin Jefferson over some of the other guys out there. So yeah, I would still play him in my lineup. Yeah, Texas Jets. So Texans, as we just talked about, lost Tank Dell, so that's huge for them. He's a big playmaker. Noah Brown has been dealing with that knee injury, so hopefully he can come back for them. They of course have Nico Collins, who came up big this past weekend, and then the Jets. Brees Hall's should be a little bit better coming off that hamstring, another week. Uh, Again, we always talk about how health matters, guys, and how injuries matter. And if you look at these teams with all these injuries that we're talking about right now, they're the ones that are on the cusp or they're already out of the playoffs. And this is a big reason why and a big factor why is these injuries.
Yeah, so again, it's super important as we head into playoffs. Health matters. Our banged up score is super predictive for how your team is going to make the playoff or not make the playoffs. We got some great stats. We got some great data. Check us out at thepredictors.com. Banged up score matters. Check us out. Thanks again for joining us. We'll see you soon.